Unit 16 Musculoskeletal System 2 60. A client has been placed in buccal extension traction. The nurse can provide for counterization to reduce shear and friction by 1. Slightly elevating the head of the bed. 2. Slightly elevating the foot of the bed. 3. Providing an overhead traps. 4. Using a footboard. The correct answer is 2. Slightly elevating the foot of the bed. 61. A nurse is conducting health screening for osteoporosis. The nurse would interpret that which of the following clients is greatest risk of developing this disorder. 1. A 36-year-old male who has asthma. 2. A 25-year-old female who jokes. 3. A sedentary 65-year-old female who smokes cigarette. 4. A 70-year-old male who consumes excess alcohol. The correct answer is 3. A sedentary 65-year-old female who smokes cigarette. 62. A home health nurse is planning to teach a client with osteoporosis about home modification to reduce the risk of falls. Which of the following recommendations would be necessary to include in the teaching plan? 1. Use of staircase railings. 2. Use of night lights. 3. Removing wall-to-wall carpeting. 4. Placing handrails in the bathroom. The correct answer is 3. Removing wall-to-wall carpeting. 63. A nurse is caring for a client with a diagnosis of gout. Which of the following laboratory values would the nurse expect to note in the client? 1. Uric acid level 8.0 mg per dl. 2. Calcium level 9.0 mg per dl. 3. Phosphorus level of 3.0 mg per dl. 4. Potassium level of 4.0 milliequivalent per liter. The correct answer is 1. Uric acid level of 8.0 mg per dl. 64. A nurse is caring for a client with osteoarthritis. The nurse performs an assessment knowing that which of the following is a clinical manifestation associated with the disorder. 1. Pain that is most severe later in the day. 2. An elevated platelet count. 3. Dull aching pain in the affected joints. 4. Elevated anti-nuclear antibody levels. The correct answer is 3. Dull aching pain in the affected joints. 65. A nurse is providing care to a client after bone biopsy. Which action by the nurse is not needed in the care of this client? 1. Monitoring site for swelling, bleeding for hematoma. 2. Administering intramuscular narcotic analgesic. 3. Elevating the limb for 24 hours. 4. Monitoring vital signs every 4 hours. The correct answer is 2. Administering intramuscular narcotic analgesic. 66. A client has had surgery repair fractured left hip. A nurse obtained which of the following most important items from the unit storage area to use when repositioning the client from side to side in bed? 1. Abductor splint. 2. Adductor splint. 3. Bed pillow. 4. Overhead traps. The correct answer is 1. Abductor splint. 67. A nurse has given instruction to a client returning home alter arthroscopy of knee. The nurse would evaluate that the client understands the instruction if the client states to 1. Stay off the leg entirely for rest of the day. 2. Resume regular exercise the following day. 3. Refrain from eating food for the remainder of the day. 4. Report fever or site inflammations to the physician. The correct answer is 4. Report fever or site inflammation to the physician.